mental health is very important for church communities. To begin with, there's a lot of stigma and discrimination around mental health. And one of the reasons is actually the stigma may be based on misunderstanding of mental health with religious connotations. Mainly, it's easy to say mental health is equal to demons. So demonization or over spiritualization, yes, there could be some demon possessions, but it's not everything. So we cannot adequately address mental health without addressing this demonization. And skills, okay? Globally, there's a shortage of mental health workers. That's one of the reasons that we don't have people available. And also those that are in the clinical setup don't have the tools and ability to engage with communities. And those that are working in the communities may not have the medical expertise. So I think there's space actually to create cross-fertilization of skills between community-based workers and health professionals, psychiatrists, and also psychologists.
I think one of the most significant programs in faith communities around sexual and gender-based violence is Thursdays in Black, precisely because it's such a simple and unobtrusive way of creating space with your body and with your presence to open discussions. In our group, we discussed how Thursdays in Black in many faith communities became the entry point for broader discussions around sexuality, around violence not only against women but also against men and sexual minorities. And this is open spaces for faith communities became more comfortable to have these discussions.
So in the context of mental health and adolescent well-being, I would like to cite a few examples where faith leaders need to get engaged in referring adolescents and young people with mental health condition to more professional assistance. So that is one area which faith-based leaders need to be able to diagnose that there are conditions which requires advanced mental health help. The other aspect is that there need to be training of those young faith-based leaders which are trained to be pastors and priests, so that they are able to address mental health in a more effective manner.
I'll share with you my experiences during the 2 years we have suffered from COVID-19, because during those times we have had rare cases of parents asking for assistance with their children because of mental health. And the way the faith community through WCC responded was basically by creating space where people can talk about these issues. And after much engagement, my recommendation is that these spaces should be more and more, so that people can also come and share their experiences, because there are people who are managing the mental health conditions well, and they can be of great help to those who are still struggling even to accept that they have mental challenges. Now, on the issue of sexual and gender-based violence, one of the ways that the faith community is engaging it is within the region of Eastern Africa. For example, we came up with this young people's movement, and we trained them on transformative masculinities and femininities and on sexual and gender-based violence, and we dubbed them game changers. So they became the agents of change in their own communities. In Uganda specifically, they registered it as a community-based organization, ecumenical network, Game Changers, and they are reaching out to young people of their age and telling them that this narrative of sexual, gender-based violence must end. And we are the change agents, because we can bring an end to it. We can change the current reality. And that movement is spreading very much within the Eastern Africa region. All the countries now, we have substantial number of young people who are giving this different narrative that a different reality is possible.
when talking about mental health and its link to sexual and gender-based violence within the churches, in the Philippines, it remains quite taboo to talk about topics on sexual and gender-based violence, as well as even mental health. But we have had the good experience that when we started the contextual Bible studies with EHIA, with the women clergy, that has opened a lot of doors when it comes to talking about gender imbalance within the church, the power dynamics, and how it can be dealt with using scripture. And that has empowered a lot of clergy women to actually open up the topic of sexuality and violence in their own congregations. And that has allowed us to have very great allies with the National Council of Churches in the Philippines to open up the HIV program. Because within HIV, you talk about sexual minorities, about women in very vulnerable situations. So that has allowed us to provide some space with the help of this women clergy to challenge their own hierarchies in their churches, to provide these spaces that are very needed. So I think with the proper use of scripture, that we are able to, and also with the Thursdays in Black campaign, it has made it more visible that these topics are very important within the church, and we have started to make spaces for it, and we have continued to do that.
Would you really want churches to do differently around HIV and mental health?
So I recall the example of the faith-based organization that I worked with in Senegal. And while I was there, we formed a support group, and it's still very active. So it's probably, 15 years old now. But I really think that the existence of that group in a community where people don't want to disclose their status was a way for people to maintain good mental health and to prevent serious issues. And at least that environment enabled people to be healthier.